Before we get into the questions, could you just share a little bit about yourself with everyone who's listening and watching?
Well, hello everyone and happy Sunday. My name is Gergana Peeva and I'm a high-risk obstetrician. Basically, my job is birthdays every day. And I work for a high-risk NHS setting, which is a national system, a health system. And also I have a private practice in London. Thank you, Mia, for having me today.
Yes, of course. And the focus of our topic today specifically is C-section deliveries. So just, thinking of all the questions, that we've heard at Nyssa that, that people have, and, just really feel so fortunate to be able to, speak to you, a doctor, about some of these questions so that we can share that information back. So let's get into it. So if you could just explain really what is the recovery process like for, somebody who's just undergone a C-section birth? What's the typical duration for recovery, and what are some ways that mothers can just heal through that particular postpartum experience?
Yes, well, thank you for actually talking to me about cesarean section. It's the best operation ever. It's an operation where we have a Lion King and we have a baby coming out, and it's the most beautiful moment from a family moment, and this is why it's my favorite, and it fills me with a lot of positive energy. Now, regarding recovery process, well, it's important to say that actually this is the only abdominal operation after which the patient, or the mother in this case, is expected to stand up on the same day to take a full responsibility for a newborn, including breastfeeding, including nappies changing, and even more, the body needs to heal fast, although it's absolutely sleep deprived and fatigued. So it's quite of an incredible expectations from a body recovery undergoing the surgery. And well, we are talking here for a double recovery, really. It's a major abdominal operation, but also it's a recovery from a pregnancy where it's the whole package of hormonal changes, body changes, the baby blues. So I would say the kinder to themselves women are, the better and faster the recovery will be. And there is no magic number of days or weeks, so we would say we would signpost for recovery, but usually on day 7, the mobility is fully back, whereas the soreness may stay for a little longer, and it depends on the type of the operation, exactly how it was done, and also which number of cesarean section it is. The cliche of the 6 weeks is not really absolutely a rule, and it's not like Cinderella on the 12 o'clock in the night of the 6 weeks, everything is fine. So everyone needs to take it easy and need to take it the way to listen to their bodies so that they can recover.
Yes, it's going to be different for everybody. And would you, I have not had a cesarean delivery. What's the general sort of protocol for, like, using stairs and things like that? Like, do you kind of encourage women to start moving around fairly soon after, or is
so I personally do encourage them to move around, and this would be one of my tips for recovery, like early mobilization. The earlier the better. I personally stand up with my patients on the same day, a couple of hours after the cesarean section, so that they can move around. And this is a great prevention to blood clots in the legs, which pregnant and postpartum women have a high risk for. And second, it's a very good prevention from sluggish bowels, so we can get the bowels moving. And stairs would not be, well, as soon as it's not like 3 floors of stairs, it should not be a problem. And on day 2, normally in England, we keep the women in the hospital. The recommended time in the hospital is about 2 nights or 3 days. On day 3, if everything has gone well with the operation, we would expect that there is no mobility issues, and stairs are absolutely okay to be.
Yeah.
Now, what other tips would I give? As I said, be kind to yourself, ladies, and be on top of the analgesia. So it's very important that you're not in pain, and it is an operation. And I would say definitely 10 days of regular medication, that you do not wait to feel pain. You just take them regularly. This will change completely the experience after an operation. The other thing, which it's bizarre, but actually a great tip, is the chewing gum. Now, chewing gums have been proven to reduce sluggish bowel, and or on medical terms called post-operative ileus. And this has been actually evidence-based. So pack up chewing gums in the hospital. This will be a great way to avoid having abdominal pain, so belly pain and sluggish bowels. The other thing,
I've never heard of that.
Yes, yes, and as I say, it's bizarre, but it's something that I do let all my patients know, and it's a good and easy way to get your bowels working.
Yeah, that's very good. I'm going to spread the word about that.
Yeah. And then also good quality postpartum underwear, obviously, very important. It's quite amazing how much that matters, and there will be a cut on your skin, so it's important that the underwear is a high-waisted one. It's important that this underwear is a breathable material, so that there is it reduces the risk of infection, so that's quite important.
Yeah.
Prevent infection. So it is easier to say than to do, but the truth is, women are usually very overwhelmed when in the first couple of days when they're alone. They have the scar, but then they're alone with the babies, and it's the breastfeeding, and they haven't slept, and very often they neglect themselves, and they neglect to look at the scar and to check for infections. And what I say is, please have these 30 seconds a day, check on them. Check for infection, check how the scar looks like.
Yeah. What would be a sign of potential infection? Would it be seeing pus, or it just being inflamed? Like, what should people be looking for?
Well, pus is the end stage, I believe. It is more if it looks red and it's overwhelmed around the incision. These are already the starting points of an infection. If there is already pus, then we are talking about a very severe infection. So that's quite good. What I recommend is showers, but not to sit in a bath until you have the bleeding from the operation, so that there are no bacteria coming on the scar. So that's important. Okay. The other thing is from a tip for the scar care. At the end of the day, the majority of the women who have cesarean section, these are young, beautiful women. We want good scars, so it's very important that we care for those scars. So C-section massage, C-section scar massage after 6 weeks, it's very, very, very essential.
That's something that somebody can do to themselves, just massaging it.
There is a lot of information online, and there are YouTube videos. In London, I work, for example, with a physiotherapy practice who are offering that after 6 weeks. They just need to be shown how to do that, the ladies, and that should be happening every day, twice a day, so that it can reduce keloid. So that means a thick scar, which obviously is not cosmetic. The other things are silicone gel, silicone sheets. These are important skincare part as well. And my last and very but not least tip for recovery is physiotherapy. Now, I cannot stress enough about that. Physiotherapy is important. Pelvic floor exercises are important, and not only for women who have given birth vaginally, but also through cesarean section, because it's not about the delivery itself, and it's not about the vaginal route of delivery. It is about the microtraumas from the heaviness of the pregnancy, and therefore it's super important that also women who have had cesarean section are not neglected in that. So
yeah, I think that's really important, because as we're always saying, like, if anyone's giving birth, like, pelvic floor therapy, physical therapy is so important. But yeah, I think you're right that sometimes people think, oh, if I didn't have a vaginal delivery, then I might not need it as much. So yeah, that's a really good point. And what are your thoughts on using ice or heat therapy on a cesarean scar as it's healing?
I think everyone should know best for themselves, but yes, ice is good, because it's also a reduction of inflammation. So ice could be quite good, and it would be good for pain as well. So rather ice than heat.
Yeah. Okay. And could you share some reasons, like, that there might be that women would choose to have a cesarean section, and why might some undergo the procedure not by choice? Like, what might be some of those reasons?
Well, in my experience, actually, these are two groups of women who may choose to have an elective, what we call an elective planned cesarean section, and these are the women who have had a previous traumatic birth, who would not like to have that again, and the other group of women who prefer not to experience labor at all. And in this group might be women who have tocophobia. This is when they have a phobia of contractions. Women with concerns regarding perineal trauma, or women with history of sexual abuse, for example, who would not be able to go through vaginal examinations and vaginal birth. And sometimes women who have quite big babies on board with diabetes mostly. And interestingly, quite a few doctors, mainly obstetricians and neonatal doctors, who choose to have that as the belief of the safest way to deliver a baby.
Yes, I was reading, I can't remember the exact statistic, but I was reading an article, and it was really quite high, the number of obstetricians who choose to have it.
Yes. I think with us, it's a little bit of the trying to have control on a situation where you cannot have a control.
Yes.
And obviously, as high risk obstetricians, we have seen really the worst case scenarios, and that still impacts us when we are about to have babies. I believe that's the reason. But vaginal birth is as beautiful as C-section.
Yes.
Definitely. Yes. And the other part was, why might
somebody have an unplanned cesarean, like, more of an emergency situation? Like, what might cause that?
Well, unplanned cesarean sections, it is quite important that women are aware from the first day of their pregnancy that there is always a risk of cesarean section. And normally the risk of cesarean section when you enter the door of a labor ward is 30%. And there are two reasons of unplanned cesarean section. The one is if the baby doesn't like the labor, that means a fetal distress, or the other reason is if the labor does not continue the way it should be. And unhappily in our language, it's called failure to progress. It's not a failure, but it's a slow progress of labor. And this can be before the cervix is 10 centimeters, which we call the first stage of labor, or after the cervix is fully gone, which is the second stage of labor. So these are mainly two unplanned cesarean section. And obviously, all the women from the group where they are planned, if the baby is deciding to come earlier, then it will be a non-planned cesarean section.
Yes. Yeah. What do you think are some of the sort of most common misconceptions or myths around C-section births?
You have to deal with them every day, no? It is, I mean, once a C-section, always a C-section. This is one of the most common, I believe. This is when women are very distressed about emergency cesarean sections where they think that that's a stigma, and it will always be that they will need to have a cesarean section. So, and this is not a truth. If there was one previous cesarean section, women can go for vaginal birth if everything went well through the cesarean section. It's just important that they plan the next pregnancy accordingly, at least 1 year in between pregnancies, and they also discuss the options with an obstetrician. The success rate of a vaginal birth after cesarean section is 75%, so it is worth mentioning it.
Yes.
Another one is that C-section has a delayed recovery. Well, I think this is also one of the most common myths, that the mother's recovery takes too long. And it is a fact that a perineal cut or perineal tear after vaginal birth needs the same time to recover as an abdominal operation. And therefore, I would not definitely be in favor of the fact that, or of the myth that C-section has a delayed recovery. So women stand up a couple of hours after the cesarean section, they walk around and they go on day 2 home. So it's not that it is so delayed. Another one is giving birth by C-section is a failure. And to be honest, we do help with that by calling it failure to progress. The one of the reasons,
right? If you're having it,
precisely, there is no failure. The truth is, cesarean section is not easier than a vaginal birth. And at the end of the day, if this is the best for a mother and the baby, it's an absolutely established way of delivering a baby. It's not easier.
Yes.
And it's not a failure.
Yeah, I think there's a really sort of unhealthy misconception that having a cesarean birth is like, you know, that you're not putting any effort in, right? That you just lay back and it's done for you, and that's not the case. You are still giving birth. It's just, you know, it's just in a different way. I really, I hope the language around that changes, and, you know, obviously a lot of people, you know, still use that, you know, natural birth versus, you know, unnatural. How do you feel about that, and what do you say if you have a patient that is, you know, talking about a natural birth versus cesarean?
Well, I always have actually the discussion with my patients very early on, like around 28 weeks, where we go through both options and what is a natural. There is nothing natural. I mean, when 40% of the babies are conceived with IVF, this is not natural either. It is more what is important is the outcome of a healthy mother, healthy baby, and the mother and the baby together. That's the priority on every obstetrician and on every part of the theme, which is the patient or the woman and her husband or partner and us. And yes, we always discuss the pros and cons, and both sides do have pros and cons, but I would not necessarily call it natural. I would call it vaginal birth versus cesarean section. There is a natural way to perform a cesarean section too.
Yes. Is there anything that somebody can, if you're having a planned cesarean, that you can do beforehand to just prepare to kind of have the most successful outcome? Would you recommend that somebody fast beforehand, for example, or, you know, anything else, or not?
Well, there are quite a few rules which all the patients will be aware of before the planned cesarean section. So very important, the fasting. So it is women are asked to fast at least 8 hours prior to surgery. And the reason for that actually are the risks which are associated with general anesthesia. That means if they have to be put to sleep in case the spinal anesthesia fails. So that's the main reason for that. The other thing is women will need bloods pre-cesarean section, and these bloods need to be taken 72 hours before the cesarean section, so that in case they need blood transfusions, there is availability of the bloods to be cross-matched for that.
Okay.
Women are also given tablets, and the tablets are against nausea and also against the acidity of the stomach, which will be taken the night before and on the day of the procedure. Now, some women may have blood thinning injections during the pregnancy. It is essential that these women stop their blood thinning injections at least 12 hours prior the operation. Otherwise, they would not be able to have a regional anesthesia, that means a spinal anesthesia. And by saying that, as I mentioned, not all the planned sections happen planned. So if you are for a planned cesarean section and you do have contractions or your waters break, please do not go and have a pizza before you go to the hospital. That's very important.
Yeah.
Just keep fasted and make your way as soon as possible.
Okay. Thank you. As a surgeon, when you're delivering by C-section to maybe somebody who's had one or two C-section deliveries beforehand, how do you go over this? Do you operate in the same place as before, like the same scar? Like, do you sort of reopen the scar, or do you go to a different place? How do you sort of approach it?
It is a well-known practice. We always take the same scar. Now, some scars, so the skin scars, some skin scars are very thick, like keloid scars, then it will be cut out and there will be a new scar. And some are so thin that they cannot be seen, then it will be just cut into the same area without cutting out the scar. But normally, for cosmetic reasons, we always take the same scar. Now, for the womb scar, it is difficult to take always the same one, but therefore, the more scars the womb has, the higher is the chance of complications later. So this is why we do not recommend more than 4 cesarean sections, for example.
Okay. And is there ever a reason that you would go, vertically in versus horizontally?
Now, there are 2 ways to cut, but obviously, for the skin, it is normally a transverse cut. For the womb, sometimes it needs to be cut also like a longitudinal. And this the reason for that is if it is an extremely preterm birth, that means a very, very early birth, or if some women have fibroids, which are like big myomas, which may be obstructing the place where we can go in the transverse line.
Okay. Let me just see. I think we've covered a lot of points. Something I was talking to a friend the other day, and they said that when they had their cesarean, they had asked for a clear plastic sheet instead of, I think quite often, there's a blue sheet, which I thought was, really amazing. Are there any sort of tips that you might have for mothers in terms of just being able to feel connected to the delivery, and then also postpartum, like in those immediate moments after, even though that you're still maybe in the process of being sewed up, like you can still have skin to skin with your baby, right?
Well, I think with the plastic sheet, that I haven't seen it before, but I think that's a little bit too much for people who cannot see blood and don't want to see everything.
You have to be sure that you can.
Yeah, I'm not sure it's a very.
In America, I don't know if it's offered.
Yes, wow, that's a little bit tough for the partners if they have to go through that. But what we do is we have a screen, and then when the baby is about to be born, we drop the skin, and basically the parents do walk this delivery journey with us. And then even today, I was having a case where we will be delivering the head and then the body, and then nobody knew what it's going to be. So it was a surprise. And then we showed them, it's a little bit of a Lion King moment, like showing the baby. So yes, that's that. And that makes them feel connected. The other thing is, as soon as possible, skin-to-skin contact, and this is something that I'm very, very passionate about it, and everyone should be able to facilitate. If babies are doing well, then they're coming straight on the chest of the mother, or with the partner, so that they feel connected. And normally, it is said within an hour. Skin-to-skin contact should be facilitated, and a cesarean section doesn't last more than 45 minutes, so we always have that in an hour.
Yes,
that mother and baby are united. Yeah,
I loved what you said at the very beginning of our conversation, that that it is, that you really love delivering C-sections, that it's a really beautiful process. I really love that. And what would you say to, just as we end this, to anybody who maybe is planning a C-section, or they're pregnant and they obviously nobody knows how things are going to shape up, but if they feel nervous about the possibility of a C-section, or what they've planned for, what would you say to them to just be reassuring?
Well, being nervous about an operation is normal. I will start first with that. Like, it's completely normal to be nervous, but the truth is, it's one of the most beautiful operations, and it's a straightforward operation, and it's an easy operation for the people who are performing it. The most important thing is that you relax and you wait, and you concentrate on the positive outcome of the operation. It is an unusual operation where we are delivering a human being, and it is not an operation for tumor or for anything else. So this is how I calm them down, I think.
I love that.
It is well, yeah, it is the whole positive experience around that, really.
Yes, and I really hope that that over time that narrative can really shift, and people can feel just as positive about having a cesarean delivery as vaginal. So thank you. I know you're at work, so I'm going to let you get back in case you have another baby to deliver.
Thank you.
Thank you so much for this conversation. I really appreciate having your expertise, and I feel that anybody who is planning to have a C-section, or is going to deliver soon, gets a lot of information and comfort out of this. So
thank you so much for having me here as well. Bye.
Bye.